questions. So, what are the main treatment options available now for liver cancer?
Yes. So again, kind of some of the things we already talked about. It's very important to know what stage your cancer is. So one important thing with most cancers, cancer may happen in a healthy organ. In the vast majority of cases for liver cancer, especially HCC, it happens in the background of cirrhosis. And I mention this because it's important to think about the liver health. I said that liver reserve is pretty high until it's not, and then you have symptoms. So it's very important to know in patients with cirrhosis how preserved your liver function and liver reserve is. And so that's one thing. And second thing, it's important to know how functional the person is, right? If you're bedridden, as much as we want to say that we want to treat this cancer, the chances are that that treatment may not help prolong your life and in fact could potentially cause more harm. So it's important to know how your liver function. It's important to know your own functional status and debility, whether you're debilitated or not. And then important to know, of course, cancer staging. When we talk about cancer staging systems, there's many available, but the ones that many of us use are the BCLC staging system, which is from the Barcelona Clinic liver cancer staging system. And so they essentially divide patients into stages of disease, as you may guess, but also look at liver function and person's functional status. So very early stage would be a lesion, very small lesion, single, less than or equal to 2 centimeters, someone with great preserved liver function, really fully functional. And those patients probably have the most options. So really could get a resection, could get certain types of local regional therapies, which either interventional radiology or interventional oncology will do, like um, radio frequency ablation or microwave ablation, where you can heat the tumor, or SBRT, which is a different type of radiation-based therapy, um, or like I said, could get resection or transplant even. So though that group has probably higher or vast number of treatment options. Now, then it goes to early stage or stage A, which is either single or up to three lesions, and they all have to be, if you have up to three lesions less than or equal to 3 centimeters, again, you have to have really well-preserved liver function, excellent functional status. And then those patients could still get resection depending on how healthy the liver is and the location of the tumors. They may still be able to get different local regional therapies, including using chemoembolization beads or radiation embolization beads, and those are called catheter-derived therapies. And transplant, of course, is an option for patients in that stage. And when I say transplant, I say liver transplant. So it really depends if you're going to get a surgical resection, if you're going to get a liver transplant, which is replacing your liver, or one of these ablative or catheter-driven therapies, that should really be a multidisciplinary discussion between the patient and their providers. Make sure that we're thinking about the best case for the patient. And then we move on to more intermediate stage, which is BCLC-B. And so these patients usually have multifocal tumors, and they can be still what we call downstage to transplant. So some patients have very well-defined tumors, and it's not as large or infiltrative, meaning it's not as well defined. But some patients in BCLC-B have like more diffuse and infiltrative tumors or on both sides of the liver. And so it really depends. BCLC-B is what we call a very heterogeneous staging. So sometimes there's more curative options if we think about transplant, and other times it's more systemic options, especially in those diffuse tumors or bilobar diffuse infiltrative. And local regional therapy can still apply, like TACE, as I mentioned, the chemoembolization beads or radioembolization beads, but again, depending on location, size, number. So that's BCLCB. And again, remember, I keep saying you have to have preserved liver function and preserved functional status. When we're thinking about BCLCC, that's more advanced stage. So those patients often have either involvement of the cancer or the tumor into their vessels, into their blood vessels, or outside of the liver, so metastatic disease. But you can also be considered BCLCC if you have really poor performance status, you know. So it's because, as I mentioned, if your performance status is more advanced, which we call 1 to 2, versus 0, which is excellent, then you may not be as good of a candidate for certain things. So that's where you can still be BCLCC, but with earlier stages of cancer. So that's why I introduced that it's really important that liver function and your functional, your physical functional reserve. Usually patients with BCLC get systemic therapy, and now it's a great time. I hate to say it's a great time to have cancer by any means, but it's a great time to have so many options for liver cancer therapies, which we didn't have even as, 10 years ago. So there's a plethora of therapies, not just first line, but multiple lines. So for those advanced stages. And then lastly, terminal or BCLCD, can really be any tumor burden, but really those with very advanced liver function. Like I said, the vast majority of cancer happens with advanced liver disease. So they may have worse ascites, malnutrition, frailty, and also in the setting of just very advanced debility. They're not able to do their ADLs, they're mostly bedridden. So those patients, any tumor burden still is advanced, and that's where you're really thinking about best supportive care, palliative care, and those are really important. I will say in those patients that are a little earlier that may require systemic therapy, like the advanced BCLCB or the BCLCC patients, beyond what standard of care, that's also important to think about clinical trials as well. So that's when, if you may not, if you progress through first line standard of care, always ask, is there a really promising clinical trial or clinical trial I could maybe understand that I could talk to you about? So clinical trials are, I know that's not part. I don't know if we talk about it later. I think we do. But it's important to just know that even in clinical trials, they are a little tight about a selection criteria. So you do have to be functional. Your liver function has to be preserved. So those are other things, again, that are important.